Hello everyone. I guess people will be joining soon. Uh, so today we'll be talking about diabetes reversal and myths around it. So I think I'll wait for a minute so that more people can join. Hello Urmimala. Hi. Welcome to the session. So sorry about this because some technical issues and I'm not very tech savvy. So this is happening, and I hope people are joining. Um so I'll give you an introduction about what exactly this live is about. So we are going to talk about diabetes reversal and myths around it. Um, According to the World Health Organization, diabetes and kidney diseases because of diabetes have caused more than 2 million deaths in the year 2019. और इसी साल ये भी रिपोर्ट्स आई हैं कि इंडिया currently has the number is second highest number of diabetes cases in the world. तो since diabetes का issues बढ़ रहा है, तो we also have seen that उसके अराउंड के मिस इन्फॉर्मेशन और मिथ्स भी बढ़ रहे हैं. तो फॉर दिस we'll be talking to Dr. Dilip Gude. He's a diabetologist and consultant physician at Yashoda Hospital, and he has over 17 years of experience in internal medicine, diabetology, rheumatology, medical bariatrics, and intensive care. So Dr. Dilip will be joining here. So, Dr. Dilip, welcome to the show.
Thank you.
How are you today?
Great. Good to be here on this platform of THIP. Yeah, good to. The topic is very relevant and important, in fact. So thank you for having me. Yeah.
Thank you so much. So I've given a brief introduction of Dr. Dilip Gude here. I'll introduce myself as well. I'm Shabnam Sengupta, and welcome all of you to this discussion about diabetes reversal and myths around it. So let's straight away dive into it, Dr. Dilip.
Sure. Yeah.
So my first question would be, can diabetes be cured completely?
So there is no a straight answer to that, because we are talking about various segments of patient population. It is not a blanket statement. So which means it is like a two or three pronged approach, as in answer to the question that you asked. So there is a good subset of patients of, say, for example, 30-40% of them who can actually get cured or reversed or get rid of themselves of diabetes. Now, there are so many international bodies, American Diabetic Association, European associations, and all, even India's own RSSGI. They say that let us not use the word cure, okay, or reversal. These are not really the words to be used when you're talking about uh, treating a diabetic patient, trying to push one from the spectrum of diabetes to non-diabetes. As in, see, basically the spectrum I'm talking about is, on one side you have non-diabetic patients with HbA1c of less than 5.8, and then you have on the extreme right you have diabetic patients, and again that is a spectrum as well: mild diabetic, moderate, and severe diabetic. There is a good chunk of pre-diabetic patients who have HbA1c of 5.8 to 6.5, as in it can be 6, 6.1, 6, no, 5.9, 6.4, and so these are all pre-diabetic patients. Now, when we're talking about reversal of diabetes, that's the reason we don't want to spread the myth or wrong message that that diabetic patients, actual diabetic patients who are very sick, they should not think and understand that their disease can completely be cured. Unfortunately, diabetes, the it is like the tip of the iceberg. Diagnosis of diabetes is you're only understanding when you see the tip, but then underneath the tip of the iceberg, you have a huge burden of the disease. So when you have someone losing 50% or more of their beta cells of pancreas, that's when diabetes starts, showing itself. As in, that's when the tests start identifying or diagnosing someone as a diabetic or not. As in, for example, these three things that we're all aware: fasting blood sugar beyond 126 milligrams per deciliter is diabetes. Now, fasting blood sugar between 100 to 125 is pre-diabetic. And likewise, HbA1c, like I said, 5.8 to 6.5. And then there is another parameter, which is post lunch or random blood sugar, which can range from 140 to 200. And they are all pre-diabetic patients. And if they do RBS, the random blood sugar, any time of the day, and it crosses 200, then they are a full-blown diabetic and they need medicines. So since, like I said, it is a spectrum, we have patients who can be moved, or people rather, I wouldn't say use the term patients. People who are diabetic, you can actually help them move to the left of the spectrum, towards the non-diabetic end of the spectrum. Now, does everyone, react the same? Is everyone fortunate enough to become a non-diabetic from, a really full-blown diabetic? No. The answer is straight away no. Now, there is a good chunk, like I said, some probably 30-40% of patients who have become diabetic because they were obese to begin with, as in their body mass index is more beyond 22.5, 27, until 25 is overweight in India, because the WHO guideline for overweight and obesity are different for Southeast Asians and for Caucasian, like a white male, for example. So when you have someone getting diabetes because they were either overweight or obese, which is actually the case in India. If you put the same statement in an opposite manner, I would say that people who are diabetic in India, there are studies that say that 85% of them are either overweight or obese, right? So that is a big chunk of diabetic population being overweight or obese. Now, when these patients, when you help them lose weight by various manners, in fact, you have lifestyle changes like diet and exercise on one side, and then there are some US FDA approved medicines that you can use if they are pre-diabetic or even non-diabetic but obese. Of course, there are some medicines which are straight away we can use. DCGI has approved for diabetic patients who are obese in India. But then there are some off-label indications for some subsets of patients who are overweight and obese, but they are not diabetic yet. So yet is important. The yet is in quotes, as in they are going to become diabetic at a later stage, right? They're not diabetic yet. They're pre-diabetic. So in 4 or 5 years, if they're not going to change their lifestyle, their diet, the kind of diet they eat, the calorie intake, if they're not burning enough calories, or there is so much high calories going in, and then no exercise, sedentary lifestyle, stress, lack of sleep, and there are so many factors basically that push one towards developing diabetes. And then this is something which may be a little as in it may not have anything to do with parents being diabetic. I mean, if one has type 2 diabetes, then it is highly likely that their parents may have been diabetic, right? Or they are diabetic. But then it is not necessarily that you are a diabetic only because you have had those genes from both your mother and father. No. Maybe the the genetic makeup of you may predispose you, for example, to becoming a diabetic at the age of 45, for example. But then we are seeing an epidemic of diabetic patients who are as young as 25, 25 to 30, and then they are diabetic. So are they diabetic now because they are genetically predisposed? The answer is no. They may develop diabetes when they're 45 because they are genetically predisposed. But then, coupled with unhealthy lifestyle choices of diet and exercise, these habits are pushing them or putting them at a increased risk of diabetes at a much younger age group. Now, coming to the point again, can someone become a pre-diabetic or a non-diabetic? Can someone who has been on, for example, insulin? I mean, we all know that someone who is on insulin means that their diabetes is pretty progressive or pretty severe. So the secretion of insulin from their pancreas is literally probably 10%, or it is not really zero, but it's probably 5 to 10%. As opposed to when they got diagnosed of diabetes, it is probably 50%. So there is a good percentage of probably 40% of them who are young. When I say young, we're talking about less than 50. So we can help them become pre-diabetic or not. Sometimes, if they're fortunate, as in if they couple their lifestyle, their diet and exercise with the medications that are USFDA approved, then yes, they can become non-diabetic completely, stop all their diabetic medications. But then, does this statement hold good for everybody? No.
Okay. So, to sum up for our Hindi speaking audience as well, कि diabetes का cure, various organizations have said this, as you said, that cure word use करना या reversal word use करना is not preferred,
Yes.
especially the word cure. क्योंकि
Remission is a word we can use.
ओके, सो रेमिशन एक ऐसा वर्ड है जो आप डायबिटीज के केसेस में यूज कर सकते हैं. रिवर्सल और क्योर जनरली जो है वो जितने बड़े इंस्टीट्यूशंस और ऑर्गेनाइजेशंस हैं डायबिटीज को हैंडल करने वाले, वो सभी डॉक्टर्स और ऑर्गेनाइजेशंस ये कहते हैं कि क्योर नहीं होता है, या क्योर का शब्द इस्तेमाल नहीं होना चाहिए, क्योंकि हर पेशेंट अलग अलग होता है, एंड सम थिंग्स कैन वर्क फॉर सम पेशेंट्स एंड द सेम थिंग वोंट वर्क फॉर द others, is what you're saying.
Yes.
So you talked about obesity and all. So I'm bringing my next question from that. Is weight loss the only solution for diabetes reversal or remission here?
Yeah. So not entirely. I mean, it is one very important pillar. Weight loss is, in fact, very, very important, because there is so much pathophysiology that goes into someone who is overweight or obese. There is a condition called insulin resistance. So when someone keeps on piling up weight, as in, if their BMI is supposed to be 22, for example, but then it is 29. Their BMI is 29, and then there is a good chunk of, say, 20 kgs of weight that they can actually lose. So when you're piling up 20 kgs of weight, your body's secretion of insulin is not matching up to the requirements of the entire body. right? So your pancreas is not able to secrete jitna insulin secrete hona chahiye utna nahi ho pa raha hai, and it is not enough basically. So in this situation there will be insulin resistance, as in there is so much fat that is building up, around the intestines. We call it omental fat. Then you have subcutaneous fat that is present so many areas on the body. Male female fat distribution may be different, but then if you look at the fat burden in the body, amount of extra overweight fat, now that is actually driving these people to becoming diabetic. And yes, no, we're not talking about genetically predisposed patients who got diabetes at the age of a later age of 45 or 50. We're talking about someone who has become a diabetic at a younger age, much younger age, just because of unhealthy food choices or having high body mass index. Now, going back to the weight loss part, so what is really happening when you're trying to bring the extra weight down? So predominantly, when someone loses fat, for example, so or on the reverse, if you say when someone is losing weight, 90% of it is usually from fat. Say, for example, there is a person who has lost 10 kgs of weight. The 9 kg or 9 and a half kgs weight that they have lost is all body fat. Maybe zero point 0.5 can be from sarcopenia, as in muscle wasting ho sakta hai. There are so many other factors, but predominantly it is fat. So when you are bringing down the fat burden, the term insulin resistance that we talked about earlier is now it is going to change into insulin sensitivity, which means that now the leaner body right now requires lesser amount of insulin by the pancreas, which is failing to begin with. So now the rate of secretion of insulin by pancreas is now matching, and it is okay for this new lean body. So yes, weight loss is an integral part of diabetes remission. But again, the million-dollar question would be, how are you going to do it? Because weight loss can be done by many processes. As in, of course, diet plays a very important role. There's a three-pronged approach. As in, one pillar would be diet, what patients are eating or not eating, rather. We want a low-calorie diet, 1,000 kilocalorie diet per day, as in we call it very low calorie. 500 to 1,000 is very low calorie. And then you have exercise, workout on the other side. On the other hand, another pillar. The third pillar would be medicines, as in there are some US FDA approved medicines which can help patients bring down their weight. And then independently also there are some medicines that have some benefit beyond weight loss. As in, if there is a person who has lost from 85 weight of theirs to they are now 75, so 10 kg weight loss has been there. Now there is another person who has lost same 85 to 75, but then this person has become a non-diabetic, while this other person 85 to 75 without using medicines is still a pre-diabetic. So there are some medicines, US FDA approved medicines, which may be working beyond just weight loss, right? So weight loss may just be one important pillar, yes, but then there may be some factors that are beyond weight loss, which can help people from becoming either from diabetic to pre-diabetic, or from pre-diabetic to non-diabetic.
Okay, so basically, weight loss is not the only way to get rid of diabetes or deal with diabetes.
I would
It's
say
a
it is a
part of
very
it.
important part. As in, I would say 80-90% of diabetes remission is because of weight loss. Maybe a 5 to 10% can be from some of the medicines that are that we are going to use, or which are US FDA approved.
Okay. So in the meantime, इसी बीच में I would like to tell our audience that the questions for this live session have been curated and collected from our community members. This community is on WhatsApp. If you're not already on this group, this is a diabetes support group. So if you're not already there, uh, the link is given in the bio. Please go to that, click on that, and join the community. Or you can DM us separately, and we'll be more than happy to add you there. So, going back to my next question, can herbal and natural products cause diabetes? So these are like the myths going on around about diabetes reversal. So these are the questions. So can herbal and natural products cure diabetes?
Uh, See, I cannot speak on that behalf because my way of practice is allopathy, and every uh, whatever medicine that I give or supplement that I suggest, these are all tried and tested. They're all evidence-based medicines. So I will really not. I mean, I would, in fact, being practicing evidence-based medicine for so far, I will really not recommend use of herbal supplements or any of these. I don't want to name the pathy, either Ayurvedic or Unani or any of those. But then I have seen some of the side effect profile of some of these non-evidence based practices, where there is lead, arsenic, mercury, and all, selenium. Sometimes these are all getting accumulated in the kidneys and liver, and then people getting various liver, kidney, and pancreas disorders. But use of herbal and natural remedies to cure diabetes is something I have not seen or experienced, or neither do I endorse it. I don't think I even at this point of time I will not encourage it. Yeah.
Okay. So, is diabetes type 2 diabetes specifically, is type 2 diabetes reversal easy? Is it possible, if someone joins one diabetes reversal program, is it possible for them to do get this reversal done in 6 to 8 weeks of joining the program?
See, like I said, when you say a program, there are so many nitty-gritties involved in it. I mean, what are they actually doing? What are they giving? And what kind of a program is it? And but I would definitely say one thing: 6 to 8 weeks is a ultra short period. If someone is promising that they are going to be non-diabetic, or there is going to be a full diabetes reversal in 6 to 8 weeks, do not believe it. Do not fall for it, because that is a little against physiology. You're going against the body's normal physiology. You will need to give 6 months at least, probably. Because we are talking about, if you're talking about weight loss, which is an integral part of diabetes reversal, in again, like I said, in some patients, not all. It takes about a healthy weight loss is about 4 or maximum of 4 to 5 kgs per month weight loss. We are not looking at 13, 14 kg weight loss in 6 to 8 weeks, which is even not really healthy, not all the time. So 6 to 8 weeks diabetes programs which are promising diabetes reversal, I would rather get full info, as in how are they doing, what is it that they are actually doing, is it evidence based, is it supported, promoted by international bodies, or are they practicing? Is it all transparent? Whatever medicine that they're giving, is it out there? As in, is there a prescription that can be screened, or that can be discussed by experts across the world? And so for example, what I have been doing, let me tell you what I usually do. So I have a really good number of probably 3 to 400 patients who are now pre-diabetic or non-diabetic, who were to begin with diabetic, like full-blown diabetic. Yes, some of them in fact were on insulin as well, not all. But yes, this number, how is it possible? I mean, 300 400 patients becoming pre or non-diabetic is yes, it is a nothing short of a for the layman's sake, it is a kind of a miracle. But then what I did was only 30% with my medicines, and with all the approved evidence-based medicines that I gave them. But then 70% of the hard work, the essential hard work, was done by the people themselves. Okay, so it depends on what they ate. Of course, I have guided them, as in what to eat, and how a very low calorie diet can be taken, how to combat, because when you're on so much low calorie diet, you're going to have acidity and so many other problems along with it. So I have guided them on diet as well, and then what not to eat, what to eat, and then there is exercise, which is another important pillar. So, diet, exercise, and then diet and exercise are all in patients' hands, as in they have to do the real hard work themselves. Of course, 30% of their remission of diabetes is something I have helped them with. So we would, I mean, if you would like to, I can go into the details of medicines that I usually use, but that may be a little technical, and you can choose. Yeah,
We can focus on that on some other day. Maybe
sure.
we'll obviously have discussions. We'll keep on having discussions like these with you. So we'll pick it up some other day. Uh, so moving to my next question, you talked about the importance of diet in the treatment process of diabetes. So can fasting result in diabetes reversal or remission?
So you must be talking about intermittent fasting, which
Yeah.
is pretty popular nowadays.
Huh.
Like I said, if you're doing intermittent fasting alone, as in, you're not, again, when you're doing intermittent fasting, what are you eating after you break your fast? There's so many variables there. Intermittent fasting is good, yes, no doubt. But can a diabetic patient do intermittent fasting with medicines on? Absolutely no, because there's a very high risk of sugars falling, right?
Hmm.
So now, can a pre-diabetic obese patient do intermittent fasting? Yes, definitely yes. But then there are some guidelines and principles that we usually recommend when people are going for intermittent fasting. As in, they need to hydrate themselves very well, because Ramzan, as we all know, it is a kind of a intermittent fasting like thing. But then they do not even drink a drop of water. There is no hydration at all. So, in fact, at that particular subset, at that time of the year, I tell diabetic patients not to fast at all, because it is fine if you're not eating anything for, say, 16 hours, 14 hours or so. But if you're not drinking water in scorching heat, I mean, usually Ramzan falls on summers and all. So there is so much heat around, and then they're already dehydrated. And then on top of it, if you add no hydration at all for so long, as in 15, 16 hours, then your kidneys are going to get hit. And if you're a diabetic, you already have some degree of kidney damage already. That is called diabetic kidney disease, which starts probably at the diagnosis of diabetes itself, right? Your creatinine, the blood test may be normal, but then there is a thing called EGFR, and then urinary albumin creatinine ratio, and there are some tests basically that gauge how much degree of kidney damage is there in a diabetic patient. So it is intermittent fasting is not for everyone, but if you're doing intermittent fasting, make sure you hydrate yourself well. Drink at least 3 or more liters of water per day, even during that 16-hour fasting period. And when you're breaking your fast, it is really important that you include the plant-based food. Make sure you have lots of roughage, that is fiber, basically, and then salads, veg salads, even fruits if you're not a diabetic. And then so it really depends on what kind of diet that you're taking when you're not doing the intermittent fasting. And then vitamins and mineral deficiencies crop up if you're doing intermittent fasting for long periods of time without proper guidance. So fasting may help a pre-diabetic obese patient or a non-diabetic patient, but for a diabetic patient who is obese, we don't recommend intermittent fasting at all, especially because there are so many classes of anti-diabetic medications which have propensity for hypoglycemia, which means the sugars fall, and that is a bigger problem basically.
Okay, so so basically, to sum it up, fasting, only fasting cannot help you in diabetes remission. सिर्फ ऐसे पूरे पूरे दिन इंटरमिटेंट फास्टिंग करने से आपकी तबीयत ज्यादा खराब होने के चांसेस हैं, ना कि सुधरने के. तो ऑलवेज consult with your doctor, with your diabetologist before doing anything, so that they can help you in your process of remission. So again, another very interesting myth that we have come across is, do insulin or diabetes medication stop the process of reversal or remission here?
Can you repeat that, please?
Do insulin or other diabetic, whatever diabetes medications are
Yes.
provided to the patients, do they stop the process of reversal of diabetes?
Yeah, that is an interesting question actually. So again, we'll have to go to the root cause of how diabetes occurs, why it occurs and all. So as we know, insulin is an anabolic hormone. When patients are taking insulin, say 30 units, 40 units or so per day, they are all going to become a little more obese, or their weight is going to increase. Every patient on insulin, eventually they start increasing weight because of the inherent anabolic tendency of insulin. Anabolic means nothing but it building, meaning there is more fat, there is more, a lot of fat, less muscle, basically. But yes, if someone is taking insulin, they are going to become overweight or obese, definitely, and which is why there are new sets of anti-diabetic medications that have been introduced in the last 8 to 10 years, where in fact the opposite is being studied and encouraged. As in, when these classes of anti-diabetic medicines are given, that is SGLT2 inhibitors, then GLP-1 receptor agonists, and all these classes, when you are giving, the insulin requirement per day is coming down. In fact, I probably have at least 400 500 patients who were on insulin before and who are obese. Okay, and they were struggling. Since they are obese, their insulin requirement over a period of time, say if they were taking 40 units of insulin last year, 1 year ago, now they are taking 50 units, and they have increased their weight by 5 kgs or 4 kgs. Next year, meaning 365 days from now, they're going to be requiring 60 or 65 70 units of insulin per day, which means that when people are becoming overweight or obese because they have been taking insulin, their insulin resistance is going up, meaning their insulin requirement per day is going up. So that is the thing. Insulin begets insulin, as in increased body fat and all. So the opposite, as in there are so many drugs that are trying to bring down the whole body fat, which is eventually bringing down the insulin requirement per day. So which is how about 500 of my patients were completely off of insulin. In fact, I could recollect a patient who was on 100 units of insulin per day, 60 units morning, 40 units night, and glimepiride 4 mg morning, another 2 mg night. So many medicines basically. And after 6 months, I could completely remove her insulin, and she lost about 22 kgs of weight. She came to my clinic in a wheelchair basically, 6 months ago. Now she walks and comes. She's super happy. She's agile. She feels light. She works out. So this is not a myth or a miracle, as in this is very much doable. But again, a select few, as in 30 40% of them, may have the luck or fortune of probably becoming insulin free, and in some groups completely probably diabetes free, as in they may be pre-diabetic, as in their HbA1c may be around 6, 6.2, 6.3 or so. And there was another group where people lost about 34 kgs, 38 kgs and all, and they were completely non-diabetic now. As in, there was a guy who was 134 kgs to begin with, and now I just saw him 2 3 days ago. He's 98 kgs now, and he's not even requiring any anti-diabetic medications at all.
So basically, you're saying that insulin increases the weight to a
Yes.
certain extent, but then you have to, like, doctors prescribe other medications as well to manage that, so that they bring down the amount of insulin they are
Yes.
providing them. Okay. So I guess these were all the questions that we had for from my side, that we curated from the community that I just spoke about. So we'll pick some other questions from the audience here. In the meantime, Dr. Dilip, do you have something to something else that you want to share with our audience for the time
Yeah.
being?
Since drugs might be a little too technical, why don't we discuss about diet and exercise? Because it appears, diet and exercise is a very loosely used, recommendation or counseling. I mean, your neighbor can tell you, diet kar lo, exercise kar lo and all. But then there is so much, science in how you do it. Because if you're not doing right, you may think you're dieting, you are working out, but then you're not really going to get the benefit, or you're not going to see the results. So let us take up one by one. Diet first. So what diet is usually recommended for? I think one of the questions, what precaution should a pre-diabetic patient take in their diet? Yeah, let us take that up. Even diabetic or pre-diabetic, in fact, for that matter. Uh, I think the focus should always be on a complex carbohydrate kind of diet. So simple carbs need to go, as in not to be taken. Simplest example for that would be when you eat three or four, say four idlis, for example, you feel hungry within an hour and a half or 2 hours. When you eat two chapatis, 2.5 chapatis or rotis, you are good. You are full for a good 3.5 hours or so. So why does this happen? Idlis are basically simple carb foods, basically rice based.
Yeah.
So our body digests it pretty fast. It assimilates, and then it is absorbed and assimilated pretty fast. And then when idli is absorbed and assimilated, insulin secretion goes up, right? It is broken down into glucose and all, within a few minutes actually, say 30 to even 1 hour or so. So then when you have glucose in the body, insulin secretion goes up, and insulin makes the glucose go into peripheral tissues like muscle, liver, skin, connective tissues, everything. So when this increased insulin secretion, insulin surge, it goes like a peak. That surge is something we need to tackle. We don't
Okay.
want food that is simple carb, that makes the immediate digestibility easier, and then immediate secretion of a spike of insulin. We want a kind of food that intestines take longer time to digest and process, so that intestinal transit time is longer, which is why a multigrain roti that you eat, for example, takes longer time to get digested, because it is complex carbohydrate. And to digest it, body takes some more time, and you feel full for that period of time. You don't have a spike of sugar followed by a spike of insulin, and which is why you're not really hungry after even until 3.5 hours or so. So then, what kind of foods should we really recommend? Now, again, one very important question most of them would be having would be non-vegetarian, as in meat intake and all. So red meat is something we don't recommend for anybody, not just a diabetic, pre-diabetic, or anybody. As in cardiovascular disease prevention, or kidney disease prevention, colon cancer prevention, and all. Red meat, as in mutton and all, so not to be eaten at all. We don't recommend that, because there is a high risk of prostate cancer, colon cancer, cardiovascular disease, risk involved directly with red meat. Now, on the other hand, white meat, that is fish, seafood basically, and chicken, for example, can be had, but provided it is not fried. Okay,
Okay.
it is just like a curry, or if you are going to grill it and all, that is okay. But then again, we need to understand that even white meat is full of calories. So you have to moderate it. If you're going to be eating every day, then make sure your other carb intake should be as less as possible. As if you're eating, say, chicken curry with rice and all, then that is a lot of calories. So if you're eating chicken, maybe bring down your rice intake significantly. If you're eating, say, 4 or 5 handfuls, bring it down to one handful. So that's about, again, seafood is really good. In fact, it has omega 3, omega 6 fatty acids in it. It actually helps bring down the bad cholesterol, improve the HDL, which is good cholesterol. So, yes, seafood definitely helps. But now going back to the vegetarian part, we recommend for people who are struggling to lose weight, or trying to become from diabetic to pre-diabetic and all, from pre-diabetes to non-diabetic. We recommend vegetarian diet. And then even in vegetarian diet, people need to make sure they eat lots of salads, veg salad, fruit salad. Fruits are again, as a blanket recommendation for diabetic patients, we recommend that the fruits that they eat be less ripe, as in a little raw. Ripe fruits, their sugar content, glucose and galactose content keeps going up, because fructose is a lot more in a ripe fruit, as opposed to the raw or unripe fruit. So that is the general recommendation. But usually, sapota, sitafal, bananas, and all, we don't recommend for diabetic patients. But
Okay.
yeah, go ahead.
No, please finish. Whatever
So we
you.
were again. I mean, this is an ocean of a subject. I can keep talking,
Yeah.
but
True.
then I wanted to focus on the weight loss and reversal part. So basically, the gist is that we want antioxidant-rich foods, as in fruits. Yes, they can have, even diabetic patients can have a fruit which is not so sweet, and then lots of vegetables. Veg salads have good antioxidants as well. Like raw, as in tomato, carrot, cucumbers, lettuce, broccoli, etc. These are all really good in antioxidants. They help. There's a lot of roughage and fiber in them, which will help their intestinal motility. Their constipation also can be treated well. if they are constipated, that is, and then they are filling. Satiety is good when you're having these salad based diet. So we recommend that let one meal, either lunch or dinner, be completely salads only.
Okay.
Okay, so we should. There is a thing called food noise. This is a term coined pretty recently, 5 6 years ago, where we're all tuned to the habit of eating food, even though we're not hungry.
Yeah.
The habit of going out, eating the high calorie foods, pastries and stuff and all. So, are we really hungry? And then there is another aspect to it. We may be thirsty basically, but then
Mm.
our body might mistake it for hunger, and then you start eating lots of food.
Mm.
So I think food noise is something which can be tackled over a period of time. It needs a lot of commitment, counseling, and motivation basically. So if you're and then if you're in fact going to work out really well, be conscious about your lifestyle, the kind of foods that you're going to eat, and bring down the calories, increase the antioxidants, bring down the salt also. Again, salt is an important thing that I want to talk about. Most people, beyond 30, 35, they're at a really high risk of hypertension or pre-hypertension. Just like there is pre-diabetes, there is a
Mm.
condition called pre-hypertension, which means their blood pressure is systolic. The upper one is 120 to 140, and then the lower diastolic is 80 to 90, right? If it is 140 by 90 or more, we call them hypertensives. But
Hypertension.
then hypertensives. So
Okay.
these people, 120 to 140 or 80 to 90 BP, they are all prehypertensives. So above 30, in fact, this there is another epidemic proportion prehypertensive population. Just from we're talking about 30 to 40
Mm.
age group. So it is universally recommended that we bring down our salt intake, probably to less than 6 grams per day. Okay,
Okay.
so and then if you look at sodium content, it is we are talking about 2 grams of sodium per day. So people may have this feeling, okay, well, then how do we get enough sodium in the body and all? Your
Mm.
foods that you're eating already have enough sodium in them. There is absolutely no need to put extra salt when you're eating curd, or for example, in any of the curries that you eat and all. So that is one another important thing that I wanted to discuss. And then trans fats are really detrimental to health. Forget obesity, of course they contribute a lot to overweight and obesity, but then trans fat intake has directly shown a link to cardiovascular disease. Meaning, when we say trans fats, it's like when you're multiple times you're heating the same oil. If you're
Mm.
eating in a street food, either anything, a lot of I think street food is something which is universal across India, north or
Yeah.
south. There's so much street
Mm.
food that we all eat, and then this oil that they fry, either pani puri or whatever it is, samosas or bhaji and stuff, the michi and all that. So they are usually, most of the time, 90% of the time, they are reheated again and again. So second time, third time, when you heat oil, there are really detrimental. I mean, I would probably put a name, poisonous kind of nature that this oil acquires, and then that is all seeped into the food that we eat. So fried foods outside, it is always better not to eat. Even at home, if you are going to have, avoid it. But if you must have, make sure that oil is not reused again. And
Okay.
in this regard, I think olive oil, people have this feeling that olive oil is good and all that. Yes, olive oil is good until you don't boil it.
Mm.
If you finish your curry, making your curry, if you're going to sprinkle fresh olive oil on the curry and mix it, it's good. Yes, the benefit retains. But when you're heating olive oil completely until it boils, no, the
Mm.
benefits are all lost.
Okay. So I guess Udmimala Sengupta asked this question about what type of fruit slash food should a pre-diabetic patients avoid. I think you've answered that question in detail here. Also, another question that she asked was what precautions should pre-diabetics take. You have also answered those questions in your move. So the next question I would like to take from here is from Nidhi Sareen. Does these obesity, so you spoke about obesity medicines. So does these obesity medications have any side effects? Nidhi Sareen asks.
Not really. Basically, there are some classes of anti-diabetic, anti-obesity medicines, which also help in reversing diabetes. So initially, they may have some stomach upset. Like there may be nausea, some vomiting. They may even have vomiting. Then their appetite comes down drastically. In fact, their food noise that I talked about, it comes down so much drastically down that if they were eating three rotis before, they would be full if they eat half a roti now, or maybe less than one full roti. So the appetite comes down drastically. But these side effect thing that we talked about with the anti-obesity medicines, again, I'm talking about only US FDA approved anti-obesity medicines. I'm not talking about Ayurvedic or herbal remedies and all. So the US FDA approved medicines, basically, there may be some kind of stomach upset. There may be sometimes loose stool, sometimes constipation. So it may take about a good 1 month of time for anybody who is on these medicines to acclimatize. But beyond that, there is no absolute long-term side effect at all. I mean, it is proven because these medicines have been in the market, as in patients have been using them for 7 or 8 years now. And in India, I think it entered second year. Basically, we're talking about semaglutide, which is available as Ribelsus. So semaglutide has been there in the market in the US, Europe for at least 7 to 8 years now. There's absolutely no long-term side effects noted. And then there are other medicines which are tagged along, which are usually used like orlistat, then acarbose metformin combinations, then canagliflozin 300 mg, etc. So, but yes, these medicines have not shown any long-term side effects whatsoever. But there are some precautions that you need to take, as in you need to hydrate really well, because you may not eat anything, but then you need to hydrate yourself. 3 to 4 liters of water per day is really important, especially when you're on these medicines. So coming back to the question, I would not use the word side effects. I would use effects. These obesity medicines may actually show some effects like stomach upset and all initially, but then those effects wane off in the second, third month, and then I'm sure by second, third month there will not be any bothersome side effect profile that patients would experience.
So I hope, Ms. Nidhi Sareen, this has answered your question. Uh, Three people have asked similar questions around stress management. Urmimala Sengupta, Shikha Shiromani, and Mehak. Can stress management techniques aid in the process, and how do it impact diabetes reversal?
Yeah, absolutely. In fact, stress is one important factor for a person to keep on piling weight, increasing body weight. There is one stress hormone called cortisol. Cortisol levels are proven to be high when the people experience persistent stress. So the converse is also true. When you try to bring down the stress level by meditation, then exercise, and deep breathing techniques, so like pranayama, for example, all these techniques will definitely help improve one's stress or decrease the stress level. And of course, sleep, a really important parameter is sleep. One should get at least 7 hours of sleep unaided, as in you should not be taking a medication to sleep, that is. So when stress level comes down overall, we are talking about overall health, as in mental health, then physical stress as well. So over a period of time, if you bring down stress level, yes, it also helps in cutting down the extra calories that you may pile up, and it also helps you in, if you're really trying to lose weight, it may help you. Meaning the delta, the quantum of weight loss may actually be more if you manage your stress levels better. Yes.
Okay. So, another question, you talked about pranayam. Urmimala Sengupta has again asked, can yoga and mindfulness practices help in diabetes reversal?
Per se, not really. Hypertension to some extent, it may be brought down, as in, say, someone who is having 150 systolic, 90 diastolic blood pressure. You can definitely bring it down to probably 140 or 137 or so systolic, and then probably 85 diastolic. But diabetes reversal, pranayam may not really have significant role. There may be some role which is not yet quantified. We don't know yet. But then does it? We can't completely think or believe at this point of time that doing pranayama or so mindful meditation alone can help one become a non-diabetic.
Okay. So I hope उर्मिमाला सेनगुप्ता आपको अपना जवाब मिल गया इस क्वेश्चन का. Another question by Garima Dev Varman is, are herbal supplements available in the market for diabetes reversal safe?
I think we discussed about it. I would, unequivocally say that they're not safe, and meaning it may be a blanket statement. I might, maybe I should not talk about all the supplements, but maybe we need to study, each supplement. What does it really have? But see, if they're not causing any harm, we don't mind, as in allopathic doctors and all. But if there is some harm, and because there are some studies that have shown that higher elements, higher heavy metals, as in lead level, mercury level, all these are a little higher in these supplements, and then they tend to keep accumulating in the kidney and liver. So forget diabetes reversal. I don't think they can help in diabetic reversal. They may actually harm your kidneys or liver in the long term. So I will definitely unequivocally not recommend any of these herbal supplements for diabetes reversal at this point.
Okay. So I hope Garima Dev Varman, you have gotten your answer for the question. So that's all we have here. So thank you very much, Dr. Dilip. It was an interesting, very informative discussion and insights from you. Thank you so much.
Thank you. Thank you.
And
To be on this platform.
yeah, I hope you enjoyed being here with us.
Yes.
And I hope that we collaborate more in the future.
Absolutely.
Yeah. For the viewers, for the audience, I would again like to tell everyone that the questions that we picked up today, that we curated, were picked up from our community of diabetes community on the WhatsApp that we have. You can join there right now. We have put in the link to that WhatsApp group. It's a diabetes support group where you'll find your peers, other patients, other people struggling with diabetes, and you'll be able to share your experiences, and you'll have a lot of other insights. Doctors like Dr. Dilip help us in our content on Thip Media, so those sort of content will also be available on that community. So please go to that WhatsApp group and join there. And I hope that all of you stay well and stay healthy. Thanks a lot, Dr. Dilip, again.
Thank you. Thank you.
Good night.
Good night.